Hey everyone, welcome to The Explainer. Today we're diving into something absolutely fascinating. We're taking a look at a brand new 40-page municipal audit from the city of Denton, Texas. Now, like so many places right now, Denton is grappling with a severe homelessness crisis. It's really a microcosm for what cities all across the country are dealing with. And to handle it, the city has poured massive resources into street outreach, emergency shelters, and even specialized police units. But you know what's incredibly valuable about an audit like this? It holds up a mirror to the whole system. We're going to unpack exactly what the city auditor found when they compared the policies on paper to the actual reality on the ground. To really grasp this, you have to understand the scale. Between 2018 and 2024, Denton's unhoused population practically doubled. It surged nearly 100%, going from around 235 people to 465. And when a population grows that fast, and folks just don't have access to stable housing, they have to build communities wherever they can. That includes complex, multi-level encampments built right up into the trees. It's a really stark, on-the-ground reality of what it means to be unsheltered when economic pressures mount and the safety net just kind of snaps. So that brings us to a vital question. Is a multi-million-dollar system actually working? I mean, when a city signs contracts with nonprofits, funds specialized law enforcement teams, and mandates all these evidence-based best practices, you expect a well-oiled machine, right? But what happens when the organizations managing the crisis totally diverge from the city's own guidelines? Think of today's explainer as a systematic checkup of Denton's response network to see if their policies actually match their daily execution. Okay, let's dive into this. Here's our roadmap for today. First, we'll cover the scope of the crisis. Then, we'll analyze encampments and crisis response. Next, we'll look at the outreach disconnect, step inside the community shelter, and finally, explore a better path forward. All right, Section 1, the scope of the crisis. Before we get into the weeds of how the system operates, it's super helpful to establish what the community actually cares about. According to a 2024 survey, 9 out of 10 Denton residents view homelessness as a major or moderate problem. And this data beautifully illustrates exactly where their priorities lie. The community overwhelmingly supports a care-based response. 54% of residents call funding for severe weather shelter essential. Another 50% say mental health programs are essential. The public mandate is clear. Citizens want their tax dollars spent on keeping vulnerable people safe and providing real health support. But here's where things get wild. The audit identifies a massive disconnect in how those resources are actually applied on the streets. 377. That is the number of citations issued over just 2 years for simple survival behaviors, things like camping in public or soliciting in thoroughfares. And get this, 72% of these citations were handed directly to people already experiencing homelessness. The city slapped these folks with over $137,000 in fines and only managed to collect about 3% of it. It just creates this endless cycle of ticketing people who literally have no ability to pay, completely diverging from the care initiatives the residents actually prioritized. Which brings us to Section 2, encampments and crisis response. So if ticketing people isn't fixing anything, we need to look at how the city handles street-level interventions, especially when it comes to mental health. What you're seeing here is the ideal federal best practice model for a mobile mental health crisis response. The goal is super straightforward. When someone is having a mental health crisis, you dispatch clinical professionals instead of armed police unless there's an immediate physical danger. You triage the call, provide peer-supported clinical response, coordinate services, and follow up. This whole diversion model is supposed to optimize police resources and give the person in crisis the exact care they need. Reality check, though, the audit reveals a completely different story in practice. Law enforcement is still responding to nearly all mental health calls in Denton. Only about 16% of these calls were completely diverted to the clinical response team without a police presence. That leaves police officers inappropriately tasked with doing social work. The dispatch system just historically defaulted to sending patrol officers. The results? You've got police responding to nonviolent mental health crises, which the auditor points out is a highly inefficient use of law enforcement's time. Moving right along to Section 3, the outreach disconnect. Out on the streets, Denton actually uses 2 different teams for outreach, a contracted nonprofit and a police homeless outreach team, or HOT. This direct comparison from the audit is honestly eye-opening. On one side, the contracted nonprofit outreach uses person-centered practices, they build trust, and they consistently meet their housing outcome goals. The catch? They rely on federal COVID-era funding that's drying up fast. On the flip side, the police outreach team fails to connect people with housing because they simply aren't positioned to do it. They literally don't have access to the primary coordinated entry housing system, and they lack basic financial resources. The audit actually highlights a story where police found a man who just needed gas money to drive home to his family in Louisiana, and the police couldn't even help him without calling the nonprofit. Plus, because they're law enforcement, their mere presence can create adversarial relationships with people who might be violating minor camping ordinances. It's a tale of two teams working in the same city, but with wildly different capabilities. Now, let's see what happens indoors. Section 4. Inside the community shelter. If folks manage to navigate the outreach teams, they hopefully make it to the community shelter. But the audit uncovers a shocking contrast between the city's contract and how the shelter actually operates. The city pays this nonprofit shelter to run a housing-first, low-barrier model. Typically, that means entry 24/7, no drug testing, and practically zero punitive rules. The whole point is just getting people inside and safe. But the reality? It's a completely different ballgame. They run daily lotteries just to get a bed. If you win the lottery, you have to check in by 6 p.m. They do bag inspections, use metal detectors, and rely on a strict progressive discipline chart for even minor infractions. As the audit plainly points out, they are running a high-barrier facility on a low-barrier contract. And the disparities don't stop there. Just look at the accommodations. The standard emergency shelter bunk beds are the ones subject to that daily lottery. In stark contrast, the shelter also has enhanced rooms. These are quieter, more private, and actually guarantee you a bed. But here's the kicker. The audit notes that guests only receive a dedicated case manager, someone to actually help them find permanent housing, if they arbitrarily get moved into the enhanced program. The auditor found this selection process lacks any clear, written criteria. So if you're stuck in the standard emergency bunks, you essentially have to wait in line every single day just to request a 5-minute meeting with a case manager. It's a massive hurdle for people desperately trying to get back on their feet. So, the crucial point is, does this strict, lottery-based system actually work? Well, brace yourself for this statistic. According to the audit, 88% of overnight guests exit the emergency shelter right back out onto the street. 88%. Only 8% successfully exit to housing, with another 4% diverted elsewhere. When you look at those numbers, it's pretty clear the shelter is operating more as a temporary holding space than an actual, reliable pathway to stability. A huge reason for that massive failure rate is the shelter's punitive discipline system. If a guest breaks a minor rule, we're talking about trying to get a second serving of food or entering a dorm room during the day, they are often hit with suspensions rather than getting social work support. And these suspensions are progressive, meaning if you had a previous 3-day suspension, your next minor infraction could automatically trigger a 3-week expulsion. In just one fiscal year, 111 individuals were completely expelled. Half of those expelled were also slapped with criminal trespass warnings by the police, making it literally illegal for them to return for help. On top of all that, the audit notes these life-altering suspension decisions are made entirely by security guards, with absolutely no input from the case managers who actually understand the guest's specific mental health needs. Okay, let's talk solutions. Section 5, a better path forward. The good news here is that the auditor didn't just point out the problems. They laid out a really constructive blueprint for the city to fix the systemic rot. First up, Denton needs to centralize how it tracks encampments so they can make strategic, data-driven decisions instead of just reacting to random complaints. Second, they absolutely have to train dispatchers to effectively divert mental health calls to clinicians, keeping law enforcement out of those situations whenever possible. Third, the city needs to seriously evaluate reallocating police outreach resources, maybe shifting that funding over to the nonprofits who are actually meeting housing goals. And finally, the big one. The city must enforce its contract. They have to force the community shelter to adopt the housing-first, low-barrier rules they are legally obligated to follow. The audit is published. The gap between expectations and reality is completely out in the open, which leaves us with this final, heavy question. Will a city follow the evidence to fix a broken system, or just continue to fund failure? Accountability is entirely in the hands of city leadership and the community now. Thank you so much for joining me on this deep dive. I hope this explainer gave you a really focused understanding of the structural realities of homelessness response, not just in Denton, but as a reflection of what municipalities are facing nationwide. Keep questioning the systems around you, and I'll see you next time.